Hello, my name is Mitchell Hoyer. I'm a fourth-year medical student at the University of Iowa and an emergency medicine residency applicant. Thank you for taking the time to learn about research my colleagues and I recently performed regarding firearm presence and storage in rural youth homes. The reason we chose to study the presence and storage of firearms in rural youth homes is because of the increasing prevalence of firearm-related injuries and suicide completions in American youth. We know the use of a firearm in a suicide attempt drastically increases the likelihood of a resultant death. In America, teen suicide is increasing at an alarming rate, and we are seeing its harmful effects. Suicide is now the second leading cause of death for 10 to 19-year-olds, and we know firearms are often involved. We see a connection among more rural counties and states where the likelihood of a gun being present in the home increases, with a higher rate of teen suicide. As this graph shows, the rate of teen suicide by firearm is nearly double that in rural counties compared to more urban settings. Apart from suicide, we also see a remarkable amount of pediatric injuries occur unintentionally from firearms. Most of these injuries occur at home, with a majority seeing the pediatric person being the one to unintentionally pull the trigger. In 2014, a study regarding firearm-related injuries and fatalities in pediatric patients found that a third of cases included the victim shooting themselves. Nearly half of the time, the child is shot by a friend or family member, and the firearm involved was owned by a family member about 2/3 of the time. The biggest risk factor in these suicides and unintentional firearm injuries is access to the firearm itself. Simply having access triples the risk of death by suicide for teens in America. This is thought to be due to children and teens still developing their frontal lobe and being more prone to impulsive action. Looking at all this data, we know injury prevention starts with preventing access to the firearm. When guns are safely secured in the home, rates of teen suicide and unintentional firearm injury among youth decrease significantly. For these reasons, the Iowa ATV Safety Task Force wanted to determine what the firearm exposure and storage practices were among youth in our state. Every year, the University of Iowa Stead Families Children's Hospital hosts a safety booth at the annual Iowa FFA Leadership Conference. In 2019, we asked participants who stopped by our booth to complete a survey regarding our objective with our demographic data collected as well. From these results, we performed descriptive and comparative analyses. We had 1,382 teens complete the survey with ages ranging from 13 to 18 years old. Of these nearly 1,400 participants, over half reported living on a farm in the country. The rest either reported living in the country but not on a farm or living in town. Of all the participants, 84% reported the presence of rifles or shotguns in their primary home. A smaller percentage, 58%, reported handguns being present in their home. Overall, over half of respondents reported having both a rifle or shotgun and a handgun in their primary home. When we compared these responses to where participants lived, we found a statistically significant relationship. Of those respondents who reported living on a farm, 91% reported the presence of a rifle or shotgun in their home, with a smaller percentage for those living not on a farm. Similarly, those who reported living on a farm had a higher response rate reporting the presence of a handgun in their home. The final statistically significant relationship between responses and demographics was related to race. Caucasian respondents had a higher proportion of rifles or shotguns in their home than other races. 84% of participants reported the presence of rifles or shotguns in their home. When looking at this positive cohort, 29% stated these guns were stored loaded at least some of the time, half stated that they were stored in an unlocked area at least some of the time, and 17% stated that these guns were stored both loaded and in an unlocked area at least some of the time. When we looked at the 58% of respondents who reported the presence of a handgun in their home, this positive cohort showed 40% reporting the gun being stored loaded at least some of the time, 43% reported it being stored in an unlocked area at least some of the time, and nearly a quarter of teens with a handgun present in their home reported it being stored loaded and in an unlocked area at least some of the time. We then asked about presence of ammunition in comparison to the firearm. If we look at the 51% of participants who reported the presence of a rifle or shotgun in their home that was stored unlocked at least part of the time, so the circled in red on this table, 46% of these teens also reported ammunition that was stored unlocked with the unlocked firearm. This response also saw a statistically significant relationship to where the respondent lived, with those living on a farm having a higher likelihood of meeting these criteria. Looking at the same population but with a handgun, those circled in red on this table, we found that 38% of them also had ammunition that was stored unlocked nearby. Finally, of those who were aware of both rifles or shotguns and handguns being stored at home, 82% of them stated that at least one of those guns was stored either loaded or unlocked at least some of the time. We conclude that a large proportion of Iowa FFA members live in a home with firearms present, and these guns are often not stored properly. This incorrect storage puts these teens at increased risk for adverse events, and we should focus on improving education for families regarding the importance of safe, proper storage of firearms and ammunition. Thank you for your time. I really appreciate it.